Hello, thank you for joining the latest one-on-one episode, a video series from Modern Healthcare Custom Media featuring insights from leaders across the industry. I'm Maria Castellucci, a custom content strategist here at Modern Healthcare. On today's episode, it's my pleasure to be speaking with Barbara McClenathan, Vice President of Perioperative Services at Surgical Directions. Barbara has over 25 years of management experience in healthcare. For 10 years, Barbara served as the Director of Perioperative Services at 3 hospitals, 2 of which were leading trauma centers. As a perioperative consultant, Barbara has facilitated and implemented process improvement and cost savings initiatives at healthcare facilities, including one of the largest Level 1 trauma centers in the South. Barbara, thank you so much for being here today. I'm really looking forward to our conversation.
Thanks, Maria. It's a pleasure to be here.
So today, you and I will be talking about a really important topic right now, which is how to mitigate nursing shortages through retention strategies, which I know is a huge challenge right now for hospitals and health systems. So let's start by setting the stage. Can you talk about what's going on right now within the nursing workforce, particularly with perioperative nurses? What's causing the shortage?
So I'd like to start off by saying the nursing shortage, yes, it's prevalent right now, but it's been predicted for many years. It's been decades where we've heard that the nursing profession in perioperative services has an aging workforce, along with lower entries within the universities, and less nurses going directly into perioperative nursing. So we've heard that it is occurring, and it's occurring tremendously right now. COVID potentiated the shortage for nurses with the workload, with nurses being transferred into areas they were not as familiar with. Another part of the nursing shortage that we're experiencing right now is the work-life balance that nurses are experiencing within perioperative services. They're many times asked to stay late. They're asked to go home frequently without pay or using their PTO time. The supplies, there's concerns with getting products to care for their patients. There's cost-cutting measures in the organization, and it's affecting their ability. There's new technology. There's disruptive physician behavior. And sometimes there's a negative culture within the organization. All of that contributes to the shortage. When the nurses that are working within an organization see that travelers are coming in and being compensated at a much higher rate, it seems like a sweet move to also take that step and become a traveler nurse, or if they're able to, they are retiring.
Wow. So definitely what I'm hearing is that there's lots of reasons for the shortages right now. We can't really pinpoint it to one thing. So like I mentioned, we want this conversation to focus on the strategies that our audience can implement to improve retention. So can we talk about how there can be even retention strategies from the hiring process, even when you're hiring someone? So how can we tackle retention through the hiring process?
Retention does truly start at the point of hiring, and one part is through providing a good bonus structure that's allocated periodically throughout the orientation piece. Having dedicated perioperative compensated preceptors that have a very detailed work plan and orientation plan is key to retaining your staff. And when the staff are a part of the orientation process, so there's feedback with their preceptors, there's feedback with the educators as well as from management. Another big piece of retention is working with all of the other staff. So in nursing, we used to have a saying that was that nurses would eat their young. Currently, we don't use that phrase. And we do a lot of training for all of the staff in the department. We like to do Surgical Actions does this. We do psychological safety training with all of the staff in the department. And this helps them use strategies and tactics to work with the new staff, to nurture, to encourage, and really share their expertise so staff will stay. Creating a good environment right from the start is key to retaining your new hires.
Yeah, such a great point about that culture piece, right? Creating the right culture from the start. So let's talk about how data and analytics can be used to help with retention. Can you share your thoughts about that?
Yes, absolutely. Data is key. Data is one of the most important things for retaining your staff. With surgical directions, we use a proprietary software. It's called Merlin. So what we do is we analyze when the surgical cases are running by time of day, by day of week, after hours, on weekends. We also look at the rates of add-on cases, emergency cases. Are there elective cases that are scheduled outside of normal block time or normal hours of operation? And then we evaluate what the productivity targets are within the organization. Many times we see that it's not realistic because of the patterns, the way the hospital is running. So what we like to do is find out what the staffing needs would be to have a high functioning department currently. And then we look at ways to improve operations if indicated, to reduce gaps in the schedule, to bring elective cases when they truly should be performed during normal business hours. And using data for predictable schedules is absolutely key for your staff. As I mentioned earlier, the unpredictable schedules is one of the greatest dissatisfiers for all of perioperative staff. By using data, you can level out the staffing and share with the staff what the needs will be in moving ahead for the next few months based on trends within the hospital. So it is essential that we do use data to help with retention.
Yeah, it sounds like data is really helping hospitals and health systems be more strategic about how they're staffing. So let's talk about career development, education, training, these kinds of aspects of being at an organization that can help with retention. So, is there a way to go about that strategy that is most effective?
So for career development, one way that hospitals like to do this is through clinical ladders. And with that, they can be designed where staff can do things exclusive of their current work that will improve their education, that will improve their competency levels. And going through the different clinical ladders, it'll also provide increased compensation. And it should be acknowledged throughout the organization as nurses and surgical technologists do move through a clinical ladder program. Another key piece is funds should be allocated so that nurses can attend their professional organizations, seek additional certifications that the hospital does support, acknowledge, and financially provide. There's another way that we move for professional development, and that's through dedicated teams. So with this, again, we like to use data. We work with your surgeons. We look what your case volume is and how many staff people should be within that team. Then we would work with the surgeons to develop a process where, for example, 75% of the time, you would have a dedicated team member within your department. It helps retention, it helps staff knowledge bases, and it really is a big satisfier for your surgeons. And there is data that does support having dedicated teams does lead to better patient outcomes. So it's a win-win across the board by moving towards dedicated teams for your perioperative staff.
Oh, that's great. That makes a lot of sense. Okay, so I wanted to talk a little bit as well about pay, which you mentioned bonuses. You mentioned that we're seeing travel nurses coming in making more than the staff nurses. So at the same time, hospitals and health systems are also struggling financially, right? So how can providers respond to these competing priorities of nurses maybe wanting higher pay, but then they're struggling financially?
Yes, you are correct, Maria. Nurses are demanding higher pay. And when you look at the workload that nurses currently have, the expectations have significantly increased. The challenges within the EMR, where they're not spending as much time with the patient, there's a lot of documentation, and technology has exploded. What the nurses need to do to utilize the equipment within the operating room has just significantly changed over the years, and compensation has not kept in line with the higher expectations. So truly, they are seeking a higher pay. As a traveler, the nurses are receiving higher pay, but we know that's not sustainable. So there are other methods that we have to look at. And one of the ways to do this is truly to evaluate what is the appropriate salary that a perioperative nurse should be receiving, and identify opportunities to assist the organization with their financial struggles, many of which is through efficiencies. through designing operational strategies that can reduce expenses, sometimes exclusive of staffing. And reducing the number of travelers, of course, is one way to reduce the financial struggles, but looking at your ROI opportunities and streamlining performance throughout the department is another way that can assist the organization with their financial challenges.
Yeah, that's great. Thank you. Okay, so we talked through a couple of different retention strategies. Are there any other retention strategies that we haven't discussed yet that you'd like to talk about?
I think some of it, and one of the things that we do with Surgical Directions is we do have workforce strategies where we look at, as I mentioned, using data to determine when the staff should be utilized. And the hospitals, one of the hospitals that we worked in, it did have a 50% shortage of nurses. So yeah, it was a rough situation. When we came on board, the staff left to go actually to local hospitals. And part of it was compensation, but that was not the whole picture. So what we did is we worked very closely with staff to understand what some of the concerns were in the organization, and they helped to redesign their workflow. They helped to redesign processes within the department, and we looked at what their challenges were. Some of it was with equipment, some of it was with competency level, some of it was with their work-life balance or their hours of operation. So there were multiple different things that we looked at to streamline the work-life balance within and the working environment within the department. And the outcome was the majority of staff did come back. And it was not exclusively for money. So it was really successful. So there's a lot of things that hospitals can do exclusive of compensation to make it a better working environment, to make the organization the employer of choice, and the staff will return and apply.
Yeah, that's great. It really sounds like the culture is really important, and listening to your nurses. What are your challenges? And then addressing it. Really effective strategies there. So thank you so much, Barbara, for speaking with me today. I think this was an excellent discussion.
Thank you, Maria. It was my pleasure.
And to our audience, thanks for tuning in today. For more information about Surgical Directions, please visit surgicaldirections.com and look for more one-on-one episodes in the coming months by visiting our website and our social media platforms. Thank you.